since then, because things change, or families change, or who knew that in January, I would be the grandmother of 7. Right now 6, but in January it'll be 7. So life changes, and sometimes you need to update things. We all know that death is inevitable. I haven't met anybody who escaped it yet. So some will be taken from us suddenly, and there is no time to prepare. Those left behind may struggle with arrangements because there are no discussions or directives to guide decisions. Did the person want organ donation? Most of us have that on our driver's license, so that's not as big a deal. But what about burial versus cremation? What about, is there a will? How many confrontations might this lead to for the remaining the people that are left behind? And it does in a lot of families, and we all have probably a story to tell, yes? How many stories? Everybody have a story about that? Some of you died, and yep, it happens. Are your desires the same now as when you documented them last? So these are all good things to think about, or for parents, or as I said, for others in the family. So today, we'll talk about some wishes, how to make them known, how to start conversations about that. Sometimes just telling a loved one, hey, there was this cool presentation at St. John's today, and that may allow you to open up a discussion that maybe somebody doesn't feel like having. Some of us are very, very resistant to having this conversation, and so that may help you. Abigail's going to work more on the palliative care side of things because that's where she has spent her the last bit of her years. She's worked for a good while as an NP, but this new part is her palliative care role. And just so you know where I've been, I've worked in surgery, internal medicine, oncology, rehabilitative medicine, and then my last 10 years were spent at the North Carolina Medical Board, where I was basically entrusted with the registration, licensure, and watch over of physicians and PAs in the state of North Carolina. So that was an interesting role too. But one of the paperwork pieces I brought is a North Carolina Medical Board document which states that we have a right to determine what we want in our lives at the end, and people need to abide by that. So when Bill and I redid our living will recently, we said that the kids can't change it because we don't want that burden on them. We also want our wishes to be honored. So no, they don't get to say, oh, just a little longer, just push a little harder. No. So these are what we want done. So these are things that just we brought along. So there's a bunch of papers up here, and we'll have those available at the end. And we're going to make this very informal. If you have a question along the way, please raise your hand so I can restate it because of the mic issue. And Abigail and I are going to kind of pass this back and forth. Sometimes, despite treatment, a terminal illness or condition is going to cause death. Patients have time to help in deciding what they do and do not want done medically, legally, and for their spiritual journey. Abigail and I will concentrate on the medical decisions. It'll be brief, but we'll have time afterwards for questions. And we'll talk about issues such as aggressive treatment that may prolong life or discontinuing treatment, which may lead to a little bit earlier death, but maybe more comfort. And we will discuss the physical journey's end. Individuals have a right to a peaceful and natural death. I think that's what we all really want. In our sleep, right? But we want that as much peace and comfort and dignity as we can get. Medical professionals encourage people to express their wishes for the kind of care preferred at the end of life. Informed patients can make informed, intelligent decisions, so discussions with providers is essential. It's really important to talk to your care providers when you're in a diagnostic situation where they can help you. Medical professionals are ethically obligated to follow the wishes of the terminally ill or incurable who wish for a natural death. Okay, so they're bound. We're bound. Withholding or withdrawing life-prolonging measures is in no manner to be construed as permitting a lesser quality of nursing care, lesser relief from pain, or a decrease in provision of any comfort for a dying patient. So a lot of times people think, do not resuscitate means do not treat. No, it doesn't. It just means we're not going to jump on your chest and break your ribs before the end of life, okay? Sometimes we need to jump on your chest and break your ribs because we can prolong your life for a good long time. The 40-year-old who has a cardiac arrest on a run in the streets, or a car accident victim or something. But, you know, a lot of times, we really, that may not be the end wish. Lost my place because I'm off the topic. There we go. Discontinuing treatment change is the goal to provide the most comfort to the patient who is dying. My mom was ticked. She was 85 and a half, 85 and 3/4. And they said, there's no more treatment for your metastatic colon cancer, which she'd had for about 2 years. She was remarkable. I mean, she went through chemo, and then she was on an oral chemo agent. She went through the IV stuff first. And then at the end, you know, the numbers were off the charts. Her liver was loaded with cancer. Her lungs were loaded with cancer. And she was ticked because they said there was nothing else to do. Now, at 80, remind you, she was 85 now. At 80, she told me she didn't know why she was still here. And at 85, she's going, what do you mean I'm going to die? So she's the most wonderful woman. This happened almost 15 years ago. Next month will be 15 years. And then, you know, we just said, Mom, we're changing what we're doing here. We're looking at comfort. So when the hospice nurses came by and they asked what she was eating, I said, well, a little bit of, you know, sometimes she'll have a little bit of cottage cheese, maybe a half of an English muffin, maybe a little boost for lunch, and as much white Zinfandel and York peppermint patties as she wants. And they said, I'm following the same diet, and I'm losing weight. And they said, can I move in? And I said, I think it only happens for the stressed out daughter. But, you know, her white Zinfandel was probably this much, like 2 ounces. But the York peppermint patties were a favorite, and it was kind of funny, because my dad used to throw things on the floor my mom had to pick up because he couldn't get it because of his arthritis, because he was 93 at the time. So I'd walk in the living room, my living room, where she's finishing her ending days, and then she's throwing a peppermint patty wrapper on the floor, and I'm like, Mom, what are you doing? And she said, I said, are you getting back? Because Dad did that stuff all the time. He was always throwing stuff on the floor. She goes, and we giggled. So, you know, but her wishes, even though she didn't want to stop treatment, once treatment was no longer working, we just did what she was comfortable for her. And actually, TV wasn't good. You know, she was really sensitive to sound, and so no TV, a little bit of quiet music. We used to dance to go to the bathroom. You know that, what's that skating song? Da, 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 da. So I'd hold her forearms on my forearms because she was pretty unsteady, and we'd sing this silly song, and we'd go to the bathroom, and then we'd go back to the, you know, to wherever she was, the couch, the chair, the bed. So comfort and dignity. What happens when a person dies? Let's talk a little bit about that. Every death is unique. Some common experiences include depression, anxiety, tiredness, sleepiness, mental confusion, constipation or incontinence, and refusal to eat or drink, or just not much of an appetite. So, York peppermint patties and white Zinfandel, right? You know, and there's some of these things can happen to the caregivers. Anxiety, depression, sleeplessness, forgetfulness, all this stuff, because you're stressed out taking care of someone. So it kind of works not just in the dying. Now, obviously, most of us have had some of these symptoms at some point. Didn't want to eat, didn't want to drink, or depressed, whatever. It's not; those are not like specific symptoms that somebody's about to die. But you know, when you put a bunch of those together and somebody has a terminal illness, you'll see more of these things crop up. At the end of a terminal disease, the person may progress. So my mom fell into basically a deep sleep and a coma. And the neat thing was, which helped me a lot, was medicating her. She had a lot of pain. So we were given baby doses of medicine because she was very intolerant to medicine. And that held her pretty well. And about 12 hours before she left us, this little crease in her forehead went away. And I thought, there, she's at rest. She's at peace. She's comfortable, and I didn't have to give her any medicine for like the last 12 to 18 hours. And so, you know, you'll see these things happen. There's some physical things you'll see. Arms and legs can get cool. My mom-in-law, who I also took care of at the end of her life, was pretty mottled, you know, kind of bluish gray, you know, losing some color because her circulation was shutting down. So you see those kind of things. There can be pauses in breathing. There's this called Cheyne-Stokes breathing. And it's a pattern that people get, and people start to freak out. It's like, no, this is again, the brain starting to shut down, and it's not doing the usual breathing pattern that we all see in this room, in about 40 people. And then some people can get noisy because, again, they're not controlling their secretions, and it can sound pretty awful to those of us who are maybe being caregivers or supporters or family members. It's not bothering the person. It's not painful to them. Their brain isn't perceiving pain or hunger the way we think about it. So sometimes that's part of what getting this information out is good about, is that you tell you that the person's, we're suffering more than they are when they're lying there in front of us and breathing weirdly, and I see a lot of head nodding that, yeah, I've seen that. And it's hard on us, but what we have to realize is if we've done everything we can for comfort measures, then these things are just part of what we see at the end of life. So I hate that term death rattle, because it's a terrible term, but that rattling breathing is what people call a death rattle. It's not painful. Finally, the chest stops moving. There's no air moving in and out of the chest, so it stops going up and down. There's no pulse. Their eyes may be a little glassy, that sort of thing. After death, sometimes there's a little jerky movement here or there, or you may hear a little sound as the last air escapes out of the lungs through the vocal cords. That's not unusual. It may sound like a little cry, but it's not. There may be release of bowel or bladder function, but mostly there's this peace. And then we, as the grieving people, caregivers, family, need to make decisions. After someone dies, you need to start grieving. You have to start, it's part of the process. They say you can't, you can try and go around it. Most of us don't make it very well. You have to go through it. And part of this is somebody wants to stay with the body and just hold their hand and be there. Somebody else can't enter the room. And we need to respect all those decisions. My youngest was 15 when Grandma died in our living room, our dining room. And I said, do you want to see her? And he said, no, I want to remember her not gone. And I said, okay. I said, you want to stay home today from school? No, I want to go to school. And he didn't tell anybody. He didn't tell any of his friends, his teachers, because he wanted to ignore it until he got home and had to deal with me. And that was okay. So, we have to give each other that grace to grieve in our own ways, and that's part of that. So I was blessed to be with both my mom. Funny thing happened with my dad. He was his final kidney shut down. He was almost 94, and he was staying at an assisted living, and the assisted living people were wonderful. They said, if you want to bring him back here with hospice, we'd be honored. And so we moved him back to his little apartment that he'd been in for like months, because he lasted 7 months after Mom died. And it was the week before their 66th wedding anniversary. So I knew it was all about. He said, I'm not having an anniversary without my wife. And I put his hearing aids in, because I knew he was in a coma, but I knew I said, Daddy, I know what this is about, and you have 6 days to get to her. He died the 24th of June, 2008, and their anniversary was the 27th. They were married in 1942 when he was in the service. So it was a good long life, and I knew it was I often say it was his last he was a very romantic man. He loved to hold her hand and all those kind of things. He wasn't a card buyer or a flower giver, but he was very romantic in other ways. And I think it was his last romantic act. But I was there at the end, and it was very peaceful. I will tell you, do not stay around for the body bag. I did that with my mom. Mistake, okay? Nobody needs to see their loved one put in a body bag. Okay, the funeral folks can come into your home, and they can do a beautiful job, and then you go in the other room while they move the person out of the house, okay? So, these are the kind of things, if we know these things and share these things, it can help others. So I was very blessed to be there. Some of my siblings, couldn't be there, didn't want to see Mom and Dad looking elderly and frail, and I'm like, well, I'm going to spend every minute I can with them. And there were some really silly times, like the York peppermint patties. Or the time in the middle of the night when my mom she was in the dining room downstairs. So I came downstairs because I heard her, and she's giggling. I'm like, what are you up to? She said, well, I was having a dream. I said, well, what were you dreaming about? She goes, well, I was dreaming about going to heaven, and I was worried about packing. And then I realized I don't have to pack. So these gifts are part of that end-of-life thing that I think, some of us need to. There's a lot of good memories and good things along with these tough times. Someone has to pronounce the person. So if they're in your home or you're in an assisted living or whatever, someone has to pronounce. So if hospice is involved, you call the hospice people. If it's an unexpected death, if Bill wakes up and I'm gone, he needs to call 911 because that wasn't expected. I'm not expecting to be dead tomorrow, but who knows? So something unexpected, you always call 911. But if it's an expected long-term illness kind of situation, there's other ways to get this person pronounced. Often there's caregivers involved, or you can call your doctor's office, or you can, there's other people that can come and pronounce and not get fire engines and ambulances and all that to your house. Seldom an autopsy is performed. I mean, it depends. It depends on the circumstances. If there's an unexpected death and that information might help the rest of the family understand why somebody died at 45, obviously that's important to do. But, if you've got, like my mom, with metastatic colon cancer, there's no reason to do an autopsy. So some families want to know some more information, and even if the medical examiner, coroner, whoever says there's no need for one, a family can request an autopsy. It's usually at their cost, but if there's something they feel that would be helpful to their family, to their history, to their genetics, that's all well and good. All right. Some decisions to consider. So advance directives. These are legal documents that Kristen, I'm hoping she's going to show up at the back door in about 20 minutes, is going to talk to you about, and those are what your wishes are. We're fortunate to have an attorney who will be coming to look into that. Healthcare power of attorney names your healthcare proxy. That means if you can't speak for yourself. So as a clinician, I'd get people calling and saying, but I'm their healthcare power of attorney and I want to have a say in this. And I said, I have a patient sitting in front of me who's perfectly capable of telling me what they want. And so you don't get to be the healthcare power of attorney when somebody's perfectly capable of telling, the care providers what they want. So, but that's that, yeah, it's an overlap. It's if, when my dad couldn't speak for himself, then I was there to make those decisions. A living will. So those are the directives. Yes?
The other thing is, though, when you're a healthcare proxy, you are making the decisions as if the same as what the patient would make themselves. It's not what you would do for yourself, it's what the patient.
Exactly. So there's the healthcare, the healthcare power of attorney, the proxy. You're going to make decisions as if you're the person, because you're going to follow what their wishes are, not make your own path. The other part, and that's why you need a living will, is that helps that person know exactly what they want. So I have a sister who doesn't have a lot of extended family on the West Coast. And her partner's of course, her primary healthcare power of attorney, but I'm next in line because I'm 6 years younger. I guess she thinks maybe I'm going to outlast her. I don't know. She's a pretty healthy liver. Things like dialysis, ventilator support, resuscitation, whether you want to be resuscitated or only by chemical means, not by a full resuscitation with the, CPR and that sort of thing. Tube feedings, organ donation, tissue donation, and just be aware, one of the things I think is really important for us to pass along is a person in the hospital having a cardiac arrest, only 10% return to their previous level of function. In the hospital, with the staff on top of you within a minute. So, that seems to be a real hang up for a lot of people, this DNR, but the reality is it just doesn't, when my grandfather had a pacemaker placed at 91, and his first question to the doctor was, well, can I still die a natural death? He said, oh yeah, it's not going to take over your heart. If it's just going to pace you, but if the whole heart gives out, no, it's okay. And he goes, well, if I go before my brother, can he have my batteries? No, we'll probably give him new batteries when he needs them. He lived to almost 96, so he got his money's worth out of that. He was a hoot. So yeah, how aggressive do you want your treatment? And as I said, DNR does not mean do not treat. It means, so you did make decisions along the way. There are do not resuscitate, but maybe they are I want to treat this pneumonia, or you want to treat a urinary tract infection. There's all kinds of things that happen along that path. And then how aggressive to treatment do people want to be? So some of my patients, when I was in oncology especially, would make decisions based on what was coming up in life. So one gentleman wanted to make a grandchild's wedding. And one gentleman, I remember him, he was like 6'4". My husband's 6'2", so I'm used to height, but 6'4", that's really tall. And his wife was like 5'1". They were the cutest couple. And I was making a home visit, and he was really going down from his lung cancer. And we knew he had metastatic disease, and it was in his brain, and he was having a hard time moving, and I was afraid she was going to get crushed because she was having a hard time getting him so we got him in the hospital, and he quickly went into a coma. But he wanted to make his 65th birthday. He was a young guy. 65's good. I'm 64. 65's really young now, right? So, but he wanted to make that 65th birthday because she got another pension if he was 65 when he passed. The nurses went in. He was in a coma for a couple of days. They went in at 1 o'clock in the morning on his birthday. They sang him happy birthday, and he died at 1:15. So we don't know what people can hear and how their internal clocks are running. So to me, be aware that you may not think that they're hearing you, but I wonder if he heard that happy birthday and checked out. So don't do it early. Yes, Ken.
My mom lived to 95, and I can identify with what happened to her in the hospital, and she had a DNR, do not resuscitate, but then she changed her mind, okay? So we had this very complex conversation. My mother was English-German, and I was Italian, English, and German. So we had this long conversation about what to do, what's best for her kind of thing. I mean, her lungs were filling up with water. It was a no-brainer. It was going to happen. I actually explained that all to her, all right? And once that happened, she was able to get rid of the mask that was on her, and they treated her properly, I think, with making her comfortable, as you say.
Yeah.
So it was a very tough discussion to have.
Yeah.
And I don't know if you have any advice on that. It seems to work out with my mother, but it depends on the people.
Right. So Ken's making a very good point that I'm doing this for the recording. So, his mom, whom I sat behind her for years and years and years in church, and she was quite the personality. And we had so much fun with her, and she was just a lovely, wonderful woman. And at her end of life, she decided to switch her DNR to I want to be resuscitated, I want to stick around even though I'm 95 and I've got it sounds like end-stage heart failure. And so how do you have that tough discussion? Exactly as you described, Ken, you lay it out to people and say, this is, I understand, and we will do that if you want, but please consider this. And I had to do the same thing with my dad. It was, just having that conversation, he was, oh, all right. That was his final, and he didn't end up, that was a hospitalization when my mom was still alive and he was in the hospital. I bring him up to Florida and he ends up in the hospital a couple of days later. She's the one who's supposed to be dying, and we're all like, typical dad, has to have the light on him, has to go in the hospital.
And here's one follow-up to that, though. It's very important to get the real story from the doctor or doctors.
Absolutely.
You can find them.
Yes. Well, that's where the PAs and NPs come into play, see? Because we're usually around.
That was the difficulty. I didn't know the lungs were filling up. I knew she was uncomfortable and everything, and I had to go and push on it to get that real piece of information.
Excellent point. So again, knowing all the factors that are putting the person in the situation that they're in, and whether it's time to have that DNR discussion or not is, they ask you, if you're going in to have a baby and you're 30 years old, they ask if you want to be resuscitated and if you have a living will. That's part of the hospital protocol now, but, a lot of us didn't experience that when we were younger because that's not what they did when I was having kids. But yeah, just know that those things are there. You have anything to add about that? Wait, can I keep going? You good?
Keep going. I'll
All
jump
right.
in a minute.
Okay. Yes.
The doctor's not hard to find when someone's in the hospital there. No matter how early you get to the hospital, the doctor was there an hour before you.
Yes.
Yeah, you just have to find your way back to find that doctor. But yeah, and nowadays things are very different because you've got hospitalists, and so you've got a primary care physician who's probably not in the hospital situation. And so again, sometimes you need to start linking into to office visits with your loved one, so that you know what's going on, and that can be very helpful as well. And not to interfere. In fact, one of our parishioners and I were talking this week, called me about something and was telling me about when she went to her elderly dad's doctor's appointment recently. And the doctor kept his focus completely on the patient and then said, "Now I see you have your daughters here. May I speak with them? Is it okay for me to speak with them?" And he said yes. And I said, "Well, obviously they're here with maybe some concern." And so they went through the couple little things that they had that they were just, he was a very healthy, he's a very vibrant 95-year-old. But he's doing some things like he doesn't want to use a cane, because he doesn't want to look old. And the doctor told him, "Sir, you are old. You're 95. You are amazing, and we want to keep you home and well and keeping getting older. So, how do we do that?" So it was a great interaction. So getting those interactions in. Feeding tubes. They're life-saving if somebody's got an acute illness or an injury or I worked in rehab. I pulled a bunch of those out. People who'd been in the hospital for weeks and weeks recovering from a car accident, a stroke, whatever. At the end of life, if somebody's going downhill with a dementia, to put a feeding tube in is going to prolong their life. Is it going to give them quality? Is it going to reverse the disease process? No. So, think about those kind of things when you're thinking about those decisions. And you are not starving a patient. Their organs are shutting down because it's time for them to leave this earth. And it's okay. And it's not painful because, as I said, their brain is shutting down and they don't feel pain and hunger the way we do. Okay, so it's very different. An NG tube, that temporary nasogastric tube can only be placed for a couple weeks. And same thing with a ventilator tube that goes through the back of the mouth. Those can only be kept in for a couple of weeks before they have to be made permanent, or you got to decide that you're not going to continue this treatment. So, my sister had an aneurysm rupture. She's 8 years older than I am. She's still with us. This happened 15 years ago. In the between my parents dying, it was a wild year. And we weren't sure she was going to wake up from this. She had a huge bleed. And they got her in a helicopter and got her to Richmond. And she was on the ventilator about 3 weeks, and I was like, oh my gosh, this isn't looking good, right? And then she woke up, and she lives on the Chesapeake Bay area, and they sail and they boat, and she can't drive because she's got a big visual field cut, but she is high functioning and doing great. So you got to give people time in those acute injury, illness kind of situations, but when we're talking about terminal end of life, that's different. So Abigail's going to talk a little bit about palliative care.
Thank you. All right, well, I haven't been on a microphone in a really long time. So I'm Abigail Mazingo. You might know me as Stephen's wife, or Emma's mom, or Gus's mom. But I'm a nurse practitioner. I've been a nurse for 12 years now, and I became a nurse practitioner 7 years ago. So my background as a nurse, just to give you a little bit about me, I was an oncology nurse as well, and I did some hospice nursing. And then I worked in the hospital on a med-surg floor. And then I went back to school. I knew I kind of always wanted to follow into the geriatric field or palliative care, hospice care. So I did internal medicine for my first few years. And then when we moved here, I became a palliative care nurse practitioner at Transitions Life Care. So that's where I work currently. So I just kind of wanted to, Kitty gave a great overview. So I'm going to kind of talk to you a little bit about palliative care and what that word means. So if you hear it, because a lot of people will hear it, of course, towards the end of life. And then also kind of palliative versus hospice and how they're kind of the same, how they're kind of different, just because that's kind of more or less my specialty. So palliative care is a term that's kind of newer, I would say. I think a lot more people know about hospice, and they think they're kind of the same. And they are. They're very similar because palliative care includes hospice care, okay? Hospice care doesn't necessarily involve palliative care, if that makes sense. So palliative care is a branch of medicine that comes into play with anyone with a chronic illness. So that can mean a lot of things. That can mean cancer that's maybe chronic or, not responding to treatment as well. It also could be dementia, is a very much a chronic illness, sure as a lot of you know. There's also heart failure, COPD, neurologic disorders like Parkinson's disease. So there's a lot of things that are chronic in nature, and palliative care can come in at any point. Okay, so it doesn't mean that someone's necessarily approaching the very end of life, but having maybe problems with symptoms. So that means like symptom management, and we do a lot of that, and then goals of care discussion. So that's kind of when, like let's say your primary care doctor's like, let's get palliative care involved. It kind of means let's kind of get the ball rolling on making some decisions, if that makes sense. So I think the decision-making process is very important. And I think Kitty said, let's talk about this sooner rather than when we're in a crisis mode. So that's kind of a lot about what I talk about with patients is talking about these things doesn't necessarily mean that the end is coming, but we're preparing for it because eventually it's going to come for all of us. So, like I said, palliative care is kind of this ongoing symptom management, goals of care discussion, and support. Hospice care comes in per Medicare, because we have to consider it Medicare, when we think someone has 6 months or less to live. So that's kind of a clinical thing that we look at, is that there has to be evidence that someone may die in 6 months, meaning they probably need more support in the home. So from a medical perspective, hospice care is more for the end of life, but people are on hospice sometimes for a long time, right? Or they can go on hospice for a while and then go off of hospice. So we've seen both. So that's kind of the difference. The hospice team, I don't know if anybody has questions about what hospice involves, but it usually involves a case manager, which is a nurse that comes to your house once a week or twice a week, however often you need. And there's just more robust services with hospice. So one thing that I'll do a lot of is goals of care discussion, which is kind of what we were talking about with advanced directives. So one thing I like to tell people is to start having conversations. That's a big thing with your loved ones, or like you said, so your healthcare power of attorney or your POA knows what you want. That's the most important thing. Sometimes I go into homes and I say I'm a palliative care nurse practitioner, and they go, "Why are you here?" Right? What does my primary think that I need to see a palliative care nurse practitioner? And they get nervous. And a lot of time they say, I saw a 102-year-old lady, and she did not want me there to begin with, because she said, I said, "Do you know why I'm here?" And she said, "You're going to teach me to die. You're going to tell me how to die." And I said, no. And we laughed about it, and we started talking, and I said, and by the end she said, this has been very informative, and just knowing that you're helping me to live, because I want to live the best quality of life I can live. And so it's really about talking to each other and talking to your loved ones about what you would like. So there's like Kitty said, there's talking about CPR, no CPR. It's talking about intubation, which is, the tube down the throat. Do you ever want to be in the ICU? Do you not? Feeding tubes, all that kind of stuff, IV antibiotics. So there's a lot of medical terms, and I encourage you too to talk to your providers about what you want, and try to make that known as well. I will say that a big thing too is, family dynamics can be tough, right? So it's not easy. Sometimes we go and be like, "Oh, this is exactly what I want," and everybody knows. But those conversations can be hard. So, enlist people to help you. That's another thing too, because there are people out there that can help. have those conversations with you. I'm trying to think of anything else I want to highlight on. Does anybody have any questions so far? Yes.
Talk a little about what is composed of the hospice team.
Okay, that's great. Yeah, so the hospice team, typically, so when we think someone has 6 months or less to live, there's usually the process is anybody can make a hospice referral. So just so you know that too, you don't need to have a doctor or a nurse practitioner or a PA say, any family member can refer to hospice. Hospice consults can happen in the hospital. They can happen at home. There's different layouts of hospice as well. I'll go into that if you want me to. But the hospice team itself, there are hospice physicians and nurse practitioners and PAs. They usually, but the main team at home, if you're talking about home hospice, is a RN, or case manager as they call them. And that's kind of your go-to. That's who sees the patient most frequently. There's also an aide service. The aide can come 3-4 days a week to help with personal care like bathing. Usually baths is a big thing, but they're awesome. The CNAs, they are lovely, and they usually really know how to assist someone at that time of life. And then the other thing is you have access to a social worker and a chaplain. So typically, or spiritual care counselor, as they call it now, because not everybody is a chaplain technically. So, but that's kind of your team. Usually with hospice, you have 24/7 access to care, but it doesn't mean you have care in the home. That's something else to think of too. Some people think you bring in hospice and you have a caregiver there all the time, and that's not true. Now, there is something called crisis care, where if someone is in like a pain crisis or agitated, or maybe in the last day of life, and they're having trouble managing symptoms in the home, then hospice can stay longer. But it's still the family that's providing most of the care. Does that make sense? Okay. Yes. I'm sorry.
Can hospice go into a nursing home?
Yes, they can. They can, absolutely. Now, there's several, in this area, there's several hospice agencies. Some nursing homes contract certain ones. So that's the only thing that would be a hold there, is like who you would get, but they're all great, and they all provide the same service. So,
Abigail,
Yeah.
my experience is that hospice is different from one state to another.
yes.
There are different names for this service in different states and that kind of thing.
Yes, so sometimes it's interesting. Some people may qualify for hospice in other states, and when they get to North Carolina, they might not. Or the reverse, right? So it's interesting because it's based on Medicare criteria, because so hospice is covered by Medicare Part A, so that's what makes it basically it's a great benefit if it's utilized properly, because you get equipment in the home that's covered, you get supplies, and medications. So everything switches to a different benefit versus your other benefit of Medicare Part B, which is like your primary care, your specialists, and all that kind of thing. So, of course, the goal is mainly to keep everything in-house, so the patient no longer has to move, but it is different. It can be different, yep, for sure.
How is it paid for?
Medicare Part A.
Is it a total, or is there a deductible piece to that?
I think it's a total. It's fully covered. Yeah, that's why it's sometimes people utilize it in the last 2 days of life, which is what it's for, and it depends on the patient what the goals of care are, but they could have had it a lot longer, if they're not aware. That's why it's good to know the services.
Is there a period of time that it's covered for?
So that's a great question. It's based on eligibility criteria. Typically, let's say you're a cancer patient with terminal illness. If they live past 6 months of life, it never terminates because they still qualify. But you can't have certain things with hospice. So, for instance, there's no curative treatments with hospice. So you can't continue chemotherapy, radiation therapy, anything that's curative. Now, if it's palliative, it possibly could be covered by Medicare, but there's certain things that aren't covered because the goals of care change to more of a comfort level approach. So, but it never terminates if the goal is comfort measures and you still qualify for the services.
It's important to talk to your caregiver, your medical coverage for that. If you have a supplemental plan or an advantage plan or something along those lines, you probably need to be in contact with them as well.
I'm not sure if it depends on. That's a good question. The supplemental insurance is usually you don't necessarily. That's a good question. I can't answer that. About the supplemental insurances, like secondaries, like if you need to be in contact with them once hospice comes on board. Yeah, social work, I guess, usually takes care of that. I'll defer to my hospice social workers on that one. Yes.
What if you're terminally ill and you don't qualify for Medicare?
There's another benefit that I believe I had actually one of my dear friends, her parents, she lost both of her parents within a year, and they were both 63, and they actually had a hospice benefit through their secondary, I believe, or Medicare. Something happens with Medicare and it is covered somehow, because I know that hospice is available for anyone under age 65. I just don't know how it works. I should know. Yes.
I just wanted to go back to when you said about having help in the house, like home hospice, you can always hire somebody
Yes.
individually to help.
Private caregivers, yep.
And we did that with my mom, but my sisters thought that we had two people, and they were there they managed their schedules, and we really needed more, and I kept telling my sisters, this is not enough. 2 people, 24 hours, is not enough to take care of her. And they wouldn't believe me, but I hate to say, luckily, we didn't have to do it for very long, but the 2 people managed 24-hour care for like 2 weeks.
I will say I think that's a gap in healthcare is the caregiver resources out there, because private caregiving is very expensive. There really is minimal. Unless you have a long-term care plan, which is great. But there are certain, because other than home health, which only is for about 5 weeks, but that's still not continuous care. That's just an aid coming in. I think that's something to realize too. I told that's something at the end that most people need, is that more help in the home, and that's not provided by anybody. Yeah. So, yes.
So Abigail brought a bunch of great pieces of information that'll be here for you to look at. But she only brought a copy, but these are things that are available to you. But Transitions Life Care has this really great piece called When Death is Near. And so this is something that transitionsoflifecare.org, you can get this kind of brochure. And then I've got some pieces up here that you can pick up after our attorney speaks, our friend, our wonderful lady who's going to come join us. So I was thinking maybe as we wrap up.
Yeah.
I think that final point that we'll end on is that practical side of, when someone's dying, it's overwhelming. It's overwhelming. And consider what chores to offer others, what things you can, that you don't want to do, and keep the things, if you're the loved one that's the closest to them, keep the things that are the most meaningful for you, keep those things. But, hey, the meals, the house cleaning, the yard work, something. And people often don't know how to help. And so somebody told me that the most wonderful thing that somebody did for her was they came over and mowed her lawn. And it was just the most wonderful thing, because she just didn't have the capacity to do that and take care of the loved one and all that sort of thing. So sometimes as we support others, if we can think about very concrete things we can do for them, instead of just saying, call me if you need something. I know what I need. You're spinning, you're swirling, you're up half the night. And so being present for each other is something we can do in that way. Consider the worries of the dying person as well. Are they worried about their pet? Are they worried about their favorite plant? Are they worried about their, whatever? And help them, settle that out so that they can be peaceful. Maggie?
That's why keeping in touch with the church is important, because we have Real Train and we have other ministries out there that
Yay.
Don't let the church know, it ain't gonna happen.
Maggie's making a very good point. And
woman who runs the meal train.
yes. So, I will say that when I was in the midst of taking care of my dying mother, Father Jerry was here, and he did come out to the house, which was it was a big help for me just to have him there spiritually for me, for Mom. And, you know, if you don't, as Maggie said, if you don't tell the church that you're in the midst of this thing, I've heard people say, well, they didn't come see me when I was in the hospital. Did they know you were at the hospital? You know, so you got to tell people this stuff. So Abigail and I are obviously members of your parish, so we are available for questions not only today, but other times. I will be here next week when Mother Sarah goes over the spiritual part of this journey. So if you have questions and want to wait till then, that's fine too. And I'm going to right now introduce Kristen to you and let her get started on her piece. So if you need to get up and stretch, now's a good time to, you know, see that. Yes. So Kristen Whitaker is an attorney. She works up in Durham, right? Oh, you're in Raleigh. Okay. She went to Florida State University for her undergraduate and did her JD at Duke. So she's a Dookie for those of you that are Dookies. You got right front and center, okay? She volunteers, so she's not only a full-time attorney, but she volunteers as an attorney for Duke Law Center Clinic. She fosters and volunteers for a local dog rescue, which hits a lot of us about, you know, animal people. And she also she's advisor for a student women's organization at Duke University. So she has a lot of different, and she practices family law, so that's why she's here to talk to us today on the recommendation of one of our parishioners. So thank you, Kristen, for being with us. I'm going to hand over the mic and sit down.
Okay. I think we're going to try to get a little PowerPoint, but if not, I can just look at my slides that I printed out. But I also have two little girls. One is turning 4 tomorrow. She's a Halloween baby. And the other is turning 7 on Thanksgiving. So I have a Halloween baby and a Thanksgiving baby. I live in Mebane, so I live kind of far away, but I work in Raleigh. I got one in school in Hillsborough, one in daycare in Durham, so I'm kind of all over the place. And then we are actually parishioners at St. Thomas More in Chapel Hill. So we'll see if we can get going, but if not, I'll grab my slides so I can just start talking.
We've got all kinds of great things we can watch, just not.
And I have a couple of cards with the other things that you can come up and pick up afterwards in case you need such support.
Yeah.
I'm sorry, I didn't actually know that you were bringing a presentation.
That's okay. It's all right. I can just talk too. That's fine. And our office is on Wake Forest Road in Raleigh, so it's not too far from here. So I always like to start out with what is estate planning. And one thing Kitty said, she said I practice family law. I do not practice family law. You do not want me to practice family law for you. I do strictly estate planning and probate matters or administration matters, and I do a little bit of guardianships, but that's it. I've been practicing for 10 years, and I promise you don't want me to do anything else for you. So estate planning is not just planning for after you pass away. It's also planning for while you're still alive. And if you can't afford to do both, I actually recommend people plan for while they're still alive versus after they pass away, because you're still alive. We want to make sure that your assets are managed, that you receive the care that you want and need while you are still living. And I know that you heard a little bit about that with healthcare powers of attorney and stuff, but I do like to tell people, because some people come in and they say, well, I don't need an estate plan. I don't have an estate. But you really do, because it's so much more than just after you pass away. It is also while you're still alive. So we emphasize managing assets during your lifetime, disposing of your assets after your death, avoiding attorney's fees, court costs, delays, and this used to be a thing now, it's not much of a thing now. Used to be a thing, but it's not much of a thing now, is avoiding taxes. Right now, our federal estate tax exemption is $12,040,000. I don't know about you, but I don't know many people that have $12,040,000. So unfortunately, I mean, if you do fall into that camp, great for you, but we don't need to do as much planning to avoid taxes as we used to. So I always like to start out with telling people or asking people, What happens if you do nothing? Because that's always an option for you when you're doing estate planning, is don't do anything at all. If you're still alive and you become sick or incapacitated, and you have not appointed someone to make financial or medical decisions for you, then a guardianship proceeding is necessary, and that is a court proceeding. Perfect. Makes it a lot easier. So a court proceeding is necessary, and the court will come in and decide two things. First, whether or not you are incapacitated or incompetent, and then second, who gets to make those decisions for you now. The court chooses who that person is. They usually do try to look to family or close friends first, but if you don't have anybody, then there is a court-appointed list of individuals that will serve as guardian of the person, which is the person that makes medical decisions, what treatments you have, what facility you're in, and then guardian of the estate, which is typically an attorney, and that's who would manage your money for you. As you can imagine, with any court proceeding, it involves a lot of fees. It also takes a long time. So there is a way to do it fast if it's an emergency, but it's really hard to meet that emergency bar. And it also takes away your control, takes away some of your dignity. I mean, you have to be served by a sheriff with a copy of that petition as part of that proceeding. And so it's just, it's very public, it can be very stressful, and you're not really giving the court or your family any guidance for what your wishes are. So what happens if you do nothing and you pass away? Well, I also tell people that if you have not done a will yourself, the state of North Carolina has written one for you. So everybody in this room has a will, whether or not you've done one. And the state of North Carolina has decided who your assets are going to go to. No, they do not automatically all go to your spouse. Okay? That is very important and something that people don't understand. Sometimes that is the case, but that's not what our statutes say. It does not avoid probate, so your assets may still have to pass through probate. Probate, people ask me, what is probate? Probate is a court process that some assets have to pass through in order to get to your beneficiaries. So the state of North Carolina has said who your beneficiaries are, but it still has to go through that process to get to them. Yes.
Quick question about
Yes.
that. So if the person who has the assets, though, has named beneficiaries with the companies overseeing the assets?
Yes.
Does that automatically, if there's no will?
Yes, so the question was if somebody does have named beneficiaries, even if there's no will, do those beneficiaries control? Yes, so there are ways to avoid probate and control where your assets go without a will. We'll talk about that in a little bit, but there are only certain assets you can put beneficiary designations on. So like in North Carolina, we don't have transfer by death deeds, which you might see in other states. So your house is a big one if you have a house that you can't put a, quote, beneficiary on. If you're not avoiding probate, you are also incurring probate fees on any assets that pass through that. It can be significant. The state does cap those at $6,000, but $6,000 is a lot of money. And if you have property in multiple states, you are looking at multiple probates. So you have to have a probate in each state. All right, so what types of assets are included in your estate? Any assets that are entitled solely in the decedent's name. So it's not like a joint account with your spouse, it's not a house that you own jointly, or if you added your daughter to your bank account, it's not those things. So if you have an account, checking account that's just in your name, even if it only has $25 in it, it's still gonna go through probate. Some jointly held assets can be included in your estate. I'm not gonna go too far into that today because it can kind of get a little murky, but typically that jointly held assets will be included in your estate if you have significant debt when you pass away. So, what type of assets are not included in your estate? So life insurance, if you have a proper beneficiary designation, If you don't have a beneficiary designation, it's likely going to go right over into that estate, which you were trying to avoid. Retirement plans, so like your 401k, IRA, 403b, 457. I feel like they keep coming up with new acronyms. Every other week I see a new one on a form. Again, with a proper beneficiary designation. Jointly held accounts with rights of survivorship, which most bank accounts or deposit accounts that you set up now are going to be rights of survivorship by default. It wasn't the case a couple of years ago, but it's pretty much the default now. Again, kind of with a little asterisk by it. If you die with significant debts, we could pull it back in. And then jointly held property. So if you own property with your spouse, or if you own property with let's say a child or a longtime partner that is held joint with right of survivorship. Property that you have inherited from your parents with your siblings is not joint with right of survivorship. So portions of property can go through probate. So what can you do? You can create a will. You can execute a durable power of attorney. You can execute a healthcare power of attorney. You can execute a living will. And you can establish some sort of trust. You can also take advantage of other strategies to accomplish your goals, one of which was already kind of brought up and mentioned a few times, but using beneficiary designations, using types of insurance like life insurance or long-term care insurance, titling assets jointly, those sorts of things. So there's lots of different strategies, and usually a good estate plan is going to utilize many of those things I just mentioned. So you're not just going to have a one-size-fits-all, do this one document, and you're good. Usually we're going to utilize multiple different planning techniques. So I'm going to start by talking about the different documents that you can use while you're still alive, because again, I think that's the most important thing. First is the durable power of attorney. So that document allows you to designate an agent and provide instructions to that agent for handling your legal and financial affairs if you become incapacitated, incompetent, or otherwise absent. A durable power of attorney does not take away your right to act for yourself. It just gives someone, your agent, equal right to also act for you. So it is something that people will use sometimes if you're going to be out of the country and you want your daughter to also be able to get into your bank account if you're on vacation and something happens. Or if you're going to buy a house and one spouse is traveling for work and they can't be at the closing. So you can sign for both spouses. Something like that. The next question people get, I'll get your question in just a second, or I always get about this, is do I need one if I'm married? Yes. Even if your accounts are all joint with your spouse, you still need one. And the reason for that is, if your spouse needs to sell your car because you are now in a wheelchair from an accident and they need to buy a handicap accessible van, they cannot sign your name on the deed to that car just because it's joint. If they need to sell your house because it's a 2-story house and you can't go up the stairs anymore and they want to buy a little ranch house somewhere, they can't sign your name on the deed to that home because they don't have power of attorney. Even if it's held jointly between the two spouses. If they need to talk to your IRA company because we need to make sure we're taking a required minimum distribution every year, they can't do that for you. So even if you're married, you still need a financial power of attorney. Did you have a question?
Yes, on the power of attorney, you said something about it gives a person access to the bank account?
It can, yes.
But isn't it like for a safety deposit box, we had to get not only myself, my wife, and my son signed up to get access to the safety deposit box. So they would, on a power of attorney basis, would they allow my son to get access, and we were both going somewhere else in the state? Would they allow people to go? My understanding is they won't allow them to go into the.
So I think that the question was, would a power of attorney allow the agent to go into a safe deposit box if needed. Safe deposit boxes are their own little beast in the estate planning world. I would probably recommend that you check with the specific financial institution to see if they would allow it. My legal argument is yes, they should be able to, because that's one of your assets and they need to be able to deal with all of your assets. But I would guess that each financial institution has a slightly different view on that and possibly have slightly different language in their customer agreements that you sign when you open accounts there that could affect that legal answer I just gave you. Yep. Mm-hmm.
So as you're talking through some of this, and your parents live in another state, are there things that you should consider that maybe you haven't otherwise done?
Yeah, so the question was, if your parents live in another state, are there things that you should consider? So both of my parents live in Florida, and so that is definitely something that you want to think about. Nowadays, it is a lot easier to access financial accounts online and to do things over the phone, especially post-COVID. They've kind of even gotten a little bit easier on that. You definitely want to know where the documents are. You want to have a copy of those documents. If your parents are willing to share login information with you, that helps tremendously. Or at least if they're not willing to share it with you now, write it down and tell you where they've put that. So even if it's just like a sticky note in a drawer of their desk, that if something happens, the first time, you can go down to their house, look in that drawer, get the login information. Obviously, you don't want to be traveling to another state multiple times a month or a year if you don't have to, but if they're willing to share it with you now, that's going to be your best option. And also just knowing what they have is a big thing too. So I get calls all the time that are, we think Dad had a life insurance policy, or I had one, her father passed away and she's in her 20s, and she said, my mom thinks he had a 401k. They were divorced. And so do you know anything about that? Well, I don't have any way to know anything about that. There's not a national database that you can search these things on. So knowing what they have is also really important.
Making sure they have computer passwords.
Yes, yes. All right, let's see.
On the durable power of
Uh-huh.
attorney, can the wife be named as power of attorney and then sign both parts of deed rentals?
Mm-hmm. Yep, so if you're married and you want to execute a power of attorney, most married couples want to name each other first. Every once in a while, I see that they don't. They want a child to do it, but that's usually because the child's already handling all those things for them anyway. So that's usually pretty far down the line when they're doing documents. Any other questions about durable power of attorney before I move on?
How many copies of the POA should you have on hand, or copies of the original as effective?
Yes and no. So they are effective, but sometimes you will have to go through additional steps to have a copy accepted. So sometimes you have to have additional affidavits or some sort of documentation saying this is an actual copy of the document. Powers of attorney, durable powers of attorney for finances can be recorded at the Register of Deeds. It's not necessary anymore. They changed the rules in 2018. It used to be that you had to have your power of attorney recorded in order for it to be effective. So that's no longer the case. We usually don't recommend you record them until you actually need to use it. So always knowing where the original is a great idea. That's what I tell people, is put the original somewhere. You know where it is and where someone else can get to it. So the get to it is the big part, because the safety deposit box question. Don't lock it in a safe deposit box nobody else can get to, but provide copies, especially to the people that you have named in the document. And so if for some reason they encounter a financial institution that absolutely wants to see the original, they will not accept a copy under any circumstances, that child or that agent can go get the original. Especially with durable power of attorney, if Duke Energy doesn't get paid for 3 days because your child's got to go to your house 3 hours away and get your document, they can wait. They're not going to shut off your life support machine or your ventilator because your Duke Energy bill hasn't gotten paid.
The reason I ask that, it seems like when I've executed a POA on a document before, the POA had to go with that document, so you've lost an original copy.
Yeah, so usually you should not let anybody take the original POA. Sometimes they will want to see it, put eyes on it, say that they saw the original. DMV is a great example of this. So you bring it in and they want to see the original, but then they will make a copy and write a note on it that it was seen, the original was seen, and then they should give you back the original. And anytime you give an original to somebody, make sure that they always give you all of the pages back.
What if your POA is already registered with the state? Should you record it? I mean, what's the...
No, I wouldn't, if it's already recorded, I wouldn't.
What's the liability in having it registered on the state?
It's just if you want to change it, you have to revoke it and record the revocation. Yeah, and it's public record, but it's more that when you revoke it, you have to provide notice to the agents in the document, and that notice also has to be recorded. It's just a lot more steps to revoke it than just tearing it up, like you could with one that's not recorded. Okay. I'm going to move on to healthcare power of attorney. You did already hear a little bit about that. I did not get here to hear the whole presentation, but I won't go into too much detail on this one. But a healthcare power of attorney allows you to appoint someone to make healthcare decisions for you if you become incapacitated or incompetent, and that one is only active or only effective if you cannot act for yourself. So it's a little different than the financial, where you can still be able to act for yourself and have an agent act for you. Healthcare, if you can talk to the doctor and you can give them answers, they're going to go with you. You can't have this other person acting for you. It allows you to indicate your wishes and limit the power of your agent if you want to. And again, do you need one if you're married? Yes. Your spouse does not automatically have the right to make those decisions for you, especially if you have children or potentially a blended family where there are children from a prior relationship that disagree with what the spouse wants to do. And then a living,
Some medical power of
yes.
attorney, the designee, I guess if the patient themselves may have some sort of dementia or some early stage of that, is it still their verbal decisions, or is it something you need to, does the doctor or somebody assess that?
Yeah, so at least the documents that I do, I don't know, I can't speak for every attorney, but the documents that I do become effective when the attending physician or the attending doctor determines that you can't make or communicate your own decisions. And a healthcare power of attorney can toggle on and off. So you can be in a car accident, you're in a coma for a couple days, but then you get better. So somebody needs to make decisions for you for a couple days, but then once you recover, you're fine. It can toggle on and off. Dementia is a tricky issue, as I'm sure we are all aware now as we have more parents and stuff that are going through it. But, it's kind of a gray area. You can have good days where you are completely competent, and then you can have bad days where you think the sky is purple and Reagan is still in office. And so it kind of can go both ways, in that somebody may need to make decisions for you one day, but they may be able to talk to you and at least have you involved in those decisions another day.
Is there any time limit? If we had something done 10 years ago and it's still relevant, does that change over time?
No. So even documents that you did 30 years ago are still effective. You just need to make sure that the people you have named are still who you'd want to act for you, because the longer they go, it might be that now you have adult children that you'd want to name in those roles instead of your siblings that you named when your children were young. Or you have moved, or your children have moved, and now you live down the street from your youngest daughter, but previously you had your oldest son because you just went by age. So that's really why I see people wanting to make changes once their children are adults, is just they want to change who they have named.
So one of the things that I've seen over the years as a priest is that when younger people have not done wills and have and that they're concerned that just the process of working with an estate planner and all that is going to be so expensive they can't afford it. So they put it off, and then it can be a real problem. So I wonder if you could speak to how much does it really cost? And then the other question is, and I know, we hope that somebody might call you for some business, but is LegalZoom an alternative for someone who doesn't have the money to work with an attorney?
Yeah, sure. So our law firm was founded and designed by our managing partner, Tim Jones, who used to work at the Wake County Clerk's Department, and so he was head of the estates division, and he saw all these people come in that needed really simple plans but just didn't have anything. And so in 2010, he tried to found our law firm on the basis of providing affordable options and doing it in a way that kind of minimizes the long, drawn-out process of doing documents so that we can get documents into people's hands. So we try to keep costs low. Right now, for an individual, if you're doing a will, durable power of attorney, healthcare power of attorney, living will, and then we have a small little HIPAA authorization that goes with all that. For an individual, we charge $450. For an individual, for a couple, we charge $550. And then if you need a living trust, which we'll talk, or a revocable living trust, which we will talk about as we go through the next couple documents, those prices start about $800 and can go up. $800 for an individual, $900 for a couple, and can go up from there depending on complexity. So, if you come in and you want to do a trust for your horses and your dogs, which I have done, I cannot guarantee you that it's going to be $800. I've also done a trust for a parrot, because those can apparently live a really long time. So we try to keep it affordable, and we also try to do it in 2 meetings or less. So, and that first meeting can be done virtually if needed.
And is there a reason not to use something like LegalZoom?
Oh yes, that was the other part of the question. LegalZoom. So yes, LegalZoom can work, and I would be more comfortable saying that LegalZoom could work for power of attorney documents versus a will and a trust. I have seen LegalZoom documents or do-it-yourself documents that work, and I have seen LegalZoom and do-it-yourself documents that really did not work. And I can usually tell what the person was trying to do by what they wrote, and just they didn't know the nuances enough to correctly draft it. You also don't, when you're working with something like LegalZoom or trying to do it yourself, you don't have the expertise and the advice of an attorney that also handles probate administration matters. And so while I can type anything you want into your will, you need to know what that's going to look like on the administration side before you decide if you actually want it in your document. And so you lose out on that piece of things. But if money is absolutely an issue, which I understand, I mean, even $800 or even $450 can be a lot for people. I would say do the power of attorney documents on LegalZoom and still try to find somebody to do a will for you. Yep, did I answer your question? Okay. All right, so we've done durable power of attorney, healthcare power of attorney, living will. So living will is a type of healthcare document. It allows you to make end-of-life decisions. If doctors have determined that you are have a terminal illness or coma, you are never going to get any better, and you are on some sort of life-prolonging measure. So that's the key with the living will, especially when things like dementia and Alzheimer's come into play. If you have dementia or Alzheimer's, but you are otherwise perfectly healthy and not on any life-prolonging measure, you're not in the living will space yet. So it's only effective if you have one of the conditions that they set out and you're never going to get any better. So a lot of people do confuse a living will with a DNR or a DNI, do not resuscitate, do not intubate, and they are not the same thing at all. I tell people end of life is kind of a spectrum. Lots of things are a spectrum in this life. You've got a DNR or DNI at the very beginning of that spectrum. They're not going to try to do anything at all. I can't do that document for you. No attorney can do that document for you because your doctor has to sign it. It's usually a brightly colored piece of paper. And then you get, there you go. Yep. Is that pink one the most form? Perfect. And then you kind of got most, which is right, I'd say maybe closer in the middle. I think it stands for medical orders of scope of treatment. Okay. And I have healthcare professionals in my family, so they teach me a lot. And then you have living will kind of on the other end of the spectrum. So we've tried all of the things. And now doctors have said, there's nothing else that we can do. What do you want to happen? And then you have some options to say, you know, who you would want to make those decisions. Do you want to go ahead and make those decisions yourself? Or do you want maximum treatment so no one can ever make those decisions for you? No one can ever take you off. Please don't ever choose that option. I've done thousands and thousands of plans, and I've maybe had 5, and every time they insist on it, I just say a little prayer that they will never be in that situation. So, having a living will in place can minimize family responsibility for making those decisions. It can minimize doctor, certainly they're going to give their opinion, but involvement in making those decisions. And it also can reduce fighting between family members sometimes, not all the time. But if you've specifically laid out what you want and you've potentially even made that decision yourself, that you already just say, go ahead, take me off if I'm in this condition, then that kind of takes the burden off of family members to make that decision for you, especially if you feel like maybe one child would decide one thing and the other child would decide something else. All right. Any questions about the documents that are valid while you're still alive before I move on?
Now, are advance directives and a living will the same thing?
Yes. I actually very much dislike the term living will. I think it confuses people. Advance directive is a much better term, but unfortunately that's what we work with.
And I will say, I think it's good that I tell people, like, oh, I have a living will, it's all taken care of, which is great, but these forms are also, like, for hospital purposes and medical purposes, these are really, really good to have, because a living will gets scanned, or you might not be able to locate it, and this is kind of like a living will in short, basically. So,
Yep.
Am I right?
Yep.
Yeah. But all 3 are fantastic.
Yeah. And for the living will and kind of for documentation where they are purposes, the Secretary of State in North Carolina does maintain a database, and healthcare registry database. I don't know how widely it is searched by doctors, but when you register your document in that database, they send you a little card back that you can put in your wallet that says, I have a document on this database. So some people will ask me, like, do I have to carry this around in my pocketbook all the time, or in my car? So that's an option for doing that, and it's $10 if you're interested. Not necessary. Yes.
Those medical forms, is that something you do in advance, like a will, or is that something that they write up when you're in the hospital for a condition?
Certainly you can do them when you're just in the hospital, but the better option is to do them ahead of time. Maybe not the DNI document, but the most form and the living will are documents that, you know.
Right, the living will, I understand.
Yeah.
These are usually done with your primary care or your physician that's or provider at PPA that's overseeing maybe the chronic condition.
But you can do them at any time. It doesn't have to be a critical condition.
Doctor?
Yep.
So you don't, is a lawyer involved, or is it
Mm-mm.
you and the doctor?
Yep. They just want to make sure that you understand and have informed consent before you sign those documents. That's why the doctor signs them. Yep. Okay. All right, well then I'm going to move on to what happens after you pass away. So what is a will? A will is a document that states your final wishes. It allows you to name an executor, guardians for minor children, decide how debts and taxes might be paid if you had any, and decide how your probate assets will be distributed. A will does not avoid probate. That is a common misconception, but it does not avoid probate. And probate is still a public court-supervised process, and so your will does become public record. And it does not provide estate tax protection, but again, it's just not a big thing anymore. So then what is a trust? A trust is a legal arrangement between a grantor, which is the person who contributes the assets, a trustee, a person who manages the assets, and the beneficiaries, which is the person or persons for whose benefit those assets are being managed. A trust can provide for management of your assets during your lifetime, and a trust can be used to avoid probate if you use it properly. So I see a lot of people that have trusts that did not fund them or didn't use them, name them properly, and so they tried to avoid probate, but they really didn't. So, and then with a trust, initially you serve as the trustee and the beneficiary of your own trust. So a trust does not necessarily require you to give up control or use of your assets. There are some types of trusts that do, but I'm not going to talk about those today. So for my purposes, you would be your own trustee while you're still alive and have capacity, and you'd also be the beneficiary of all of your trust assets while you're still alive. And then at your death or incapacitation, then you have a successor trustee listed to take over to manage those assets for you. So some assets of a trust are, it can provide greater flexibility. Like I said, we've had a trust with 2 horses and a dog in it, so you can do a whole lot of things with a trust that you can't do with a will, or that you wouldn't want to do with a will, I should say. A trust can avoid probate. It can be used as a tax planning tool if that is something that applies to you. A trust can provide for management of assets for minor children or children with special needs. It can also provide for management of assets for adult beneficiaries that maybe are irresponsible or have substance abuse problems. It can minimize your exposure to estate litigation because trusts are typically more private documents, so they do not become public record. And so if you leave one child $10,000 and another child $20,000, they don't really know what the other one got unless they choose to disclose that. So it can, I don't want to say it does, but it can reduce your exposure to estate litigation. And it does allow you to maintain some control over your assets after your death if you want to. And so, let's see. If you don't want your house to ever be sold, or if you only want your child to get a certain amount of money every month, something like that.
You said it made me think that you would be consulted somewhere.
Oh yeah, no. I'm trying to think what the name was for law school, but there's it's like a invisible hand that they show you. No. Anyway. A trust doesn't necessarily have to change the day-to-day use or enjoyment or administration of your assets. So just because you set up a trust doesn't mean you're limited for how you spend your assets. You can put whatever you want in your trust, and you can take whatever you want out of your trust at any point. So some people get worried about that. You can also amend or revoke your trust at any point while you're still alive and have capacity as well. So you're not doing, at least for my purposes, I don't do a lot of irrevocable trusts. Let's see. So, do you need a trust? Not everybody needs a trust, especially in the state of North Carolina. And the reason for that is that in North Carolina, your real property, which is houses, land, those sorts of things, those do not pass through probate unless needed to be sold to pay creditor claims. So immediately upon your death, by operation of law, your property passes to whomever your beneficiaries are, whether that's your children or siblings or a charity. That happens automatically. So in a lot of other states, you see trusts used a lot more frequently than you do in North Carolina, and that is simply because in most other states, your property does pass through probate. So if you have property in multiple states, you definitely need a revocable living trust. If you have minor children or beneficiaries with special needs, you definitely need a revocable living trust. If you have a very complicated distribution scheme that either you need a trust to be able to simplify beneficiary designations or you want to keep it private, you should use a trust. If you have, I already mentioned this, but if you do have irresponsible adult beneficiaries or adult beneficiaries with substance abuse problems, especially if receiving a large sum of money would cause them to do harm to themselves or to someone else, because we do have to be practical about that, we recommend that you use a trust. Or if you just want to keep things private, so you just don't want people to know who you're leaving your assets to, you would use a trust. And then I tell people you probably don't need a trust, and there's a little asterisk there because this isn't legal advice. But if all of your property is in North Carolina and all of your beneficiaries are adults and are responsible. Yep.
Do you need a trust in each state where you might have?
No. You do one trust, and you put all the property in all the states in the one trust. Yes.
Is there a problem with executors or trustees or even powers of attorney living outside of North Carolina?
No. And I actually have people, that's common misconception, and that I couldn't name that child because that child lives in Tennessee. Nope, not a thing. Now, it's certainly easier if they're in North Carolina, but I also have clients that I've never even met before. I had a client in Ireland for about 7 years, and so I never met him, just did it on the phone and email.
You need a financial person to manage the trust for you.
Yes. Well, you need a trustee, and one of those things that I tell people when you're trying to decide who your trustee is somebody that knows how to financially manage your assets or that knows enough to know they don't know that and will hire somebody.
Okay.
Yeah.
Because otherwise, hiring somebody now to manage your trust, depending on the size of it, will cost you money on a regular basis.
Yes.
A percentage fee of what your assets.
Yeah, there are corporate trustees out there, so if you don't have a child or a trusted family member or friend that you want to do that for you, so let's say you really think your children are going to fight, then there are corporate trustees and executors that will do that for you, but they do charge a fee, and it's usually a percentage based on the amount of assets that they are managing. They usually also have minimums. So the lowest minimum I've seen in a trust is $250,000. The highest minimum that I'm aware of is $2.5 million. So they won't serve until you have that many assets.
I want my child to earn what he's going to get.
Yep. And there's one way in the back there.
What does the word entail mean when it comes to property?
Give me an example.
Like a person has property, they can leave a house to somebody and a lot to somebody else, but a certain part of the property is entailed.
I have never heard that before, but my guess based on the example you just gave me is that they've put some sort of conditions on that property. In one of the examples I used earlier was if you don't want your house to ever be sold, or if you want, I have one right now that I'm working on where the woman wants the current tenant to be able to live in it as long as she wants. So some sort of condition that the trust or maybe through an easement or covenant or something has been put on the home, in that, you know, it either can't be sold or it can only go to a conservation charity or something like that. Does that answer your question?
Not really.
I'm sorry. I can try to get you a better answer when we're done here today. Any other questions before I go on? Okay, so some other tools for estate planning besides a will and or a trust are jointly held securities and bank accounts. So that's where at least two individuals share ownership, and it must be held with rights of survivorship, which again is normally the default now. Joint property still may be subject to creditor claims, so just because you put your daughter on all your bank accounts, but you have $30,000 of credit card debt, doesn't mean that all of that passes with outside of, or not subject to that creditor debt. And jointly held accounts and securities do avoid probate, or I should say may avoid probate at the death of the first owner or the first spouse, but without any subsequent planning, it's not going to avoid probate at the death of the second owner or the second spouse. Jointly held real estate, so again, that's where at least two individuals share ownership. It can be in different proportions as well. It may be held with rights of survivorship, although that is not the default, like it is with joint bank accounts. So the deed actually has to say joint with right of survivorship, or you have to own it as husband and wife. If you bought the property before you got married, even if it was the day before, it does not become husband and wife property once you get married.
Or legal spouses.
Yes, or legal, yes. That is the more politically correct way to say it, yes. That getting married does not change it over to that what's called tenants by the entirety protection. You also can own property where you retain lifetime rights and you give the remainder interest to somebody else. I find a lot of people come into my office and they say they want lifetime rights, but when I tell them what lifetime rights actually are, they don't really want it. Because if you do retain lifetime rights or you own property with someone else as joint owners, everybody has to still consent to the sale. And then with lifetime rights, if you wanted to, let's say you retain lifetime rights in your home, but you give the remainder interest to your children. If you did want to sell that, not only would your children have to consent to the sale, but then your children get a portion of the proceeds. And that portion is determined based on what your expected lifetime is on the day that you sell it. So a lot of people don't like that part of it. It works in very limited circumstances, but usually if you wanted to retain lifetime rights, we probably would use a different planning technique in order to get you that same result. I don't know if you talked about long-term care insurance, but sometimes long-term care insurance can be used as an estate planning tool, and it can provide a source of income if you were to need to live in assisted living or skilled nursing care, and it is not income dependent like some government benefits are, like Medicaid or special assistance. So some people like it, some people don't. I don't sell it, so I have no opinion on it. But if you are interested, that is sometimes a planning technique, so you have more assets to pass on to your children or to your beneficiaries. Life insurance is another planning technique. It does provide a guaranteed source of income or support for your beneficiaries after you pass. It does also provide a tax-free way to transfer wealth. So there are no taxes on life insurance to whoever you leave it to. And it usually does not pass through probate if you have a proper beneficiary designation. So I've said that probably a dozen times at this point. If you can't tell, it's very important. And then pensions and retirement accounts, those usually do not pass through probate either, again, if you have a beneficiary designation. I do see a lot of people nowadays doing conversions from retirement accounts to other tax-free ways to transfer wealth to their individuals. Again, I don't sell it, I'm not a financial advisor, so please talk to your financial advisor if you're interested in this. But in 2020, before the pandemic, Congress actually changed the laws with how retirement accounts are inherited by your beneficiaries. So it used to be that if you left your retirement account, say, to your adult children, they could take out their inherited portion over their expected lifetime, so they could stretch out those distributions and pay the taxes a little bit over time. Congress shortened that from their expected lifetime to 10 years. And so now they have to take all of the retirement account money that you leave them out by the end of the 10th year. And so some people are now choosing to work with their financial advisors to potentially take bigger distributions while they're still alive and convert that to something like life insurance that your children would inherit or your beneficiaries would inherit tax-free. So I only say that, again, I don't do any of that, but it's just a question that you might want to look into with your financial advisor to see if that's something that might work for you. All right, let's see. I might have have been my last slide. Oh, nope, I got one more. What should you do now? So first step is to identify your goals. Those may include simplicity, it may include control after you pass away, it may include privacy, it may include providing for a beneficiary that might need it more than the others. It might include charitable giving. So identifying what those goals are. The second step is to identify what your assets are and how you own them, and if you have beneficiaries on them, especially if they are accounts that you set up a long time ago, like life insurance or retirement, where you may not have named a child as a secondary beneficiary or something like that. Maybe that child wasn't even born yet when you started that job, and now it's a little different. So how you own it, who the beneficiaries are, and who has access. So making sure that somebody knows what those assets are, knows where you're keeping your list of assets, knows where you're keeping your passwords, knows where you're keeping your documents, that you have not locked all of those things in a safe deposit box that nobody can get into. A lot of people are worried about keeping those things in their home because they are worried their house is gonna burn down. I've been doing this for 10 years. I've done thousands and thousands of plans. I just had my first one where the house burned down and the documents were destroyed. And luckily they had copies and everybody survived the house fire. So if your documents, your house did burn down and your documents were in your home and they burned down, hopefully you will survive and you call me and we execute new originals for you. So I get calls at least once a month that they can't find their documents because they lost them, or that mom or dad passed away and we have no idea where their documents are. We found your card, but we don't know where the documents are. So I am much more worried that somebody is not going to be able to locate your documents or know what assets you had than I am that your house is going to burn down and your documents are going to burn down in your house. So, and then once you do that, identify your goals and identify your assets, then you should sit down with a lawyer, a financial planner, somebody that you trust who can help you determine what tools will work best for your goals and your assets. So it doesn't necessarily have to be an attorney. We did talk about some other ways to avoid probate and get your assets where you want them to go, but at least sitting down with somebody you trust initially who can help you figure out the best tools for you and then potentially get you to someone else that can help you. And that's all I got. I don't know how long I talked, but I think I'm good. And then my cards are up here if you do have questions.
Kristen, thank you so much. That was awesome. Thank you. So we're going to wrap up, and you are welcome to stay, pick up some documents, pick up a card of Kristen's and her colleagues who are family law. do estate planning, and my fault. And look at these things, and if there's anything else we can do for you, you know where to find Abigail and me and Mother Sarah. Thank you so much. And next week we will do the piece on the spiritual aspects at 11 here. Thank you.
One thing Mike mentioned, and I was going to raise my hand.